Hello, everybody. Welcome you all to the special webinar that we mark the day. So this special webinar, we are picking up the dates that, Thailand is coming to the 59 days of the zero case of the coronavirus affected to the Thai people. I mean, domestic case for 59 days. So that's why today is a good opportunity for us to share the experience with you, what made Thailand win the first fight of the pandemics. So we are hoping that this information sharing and also the sharing of experience will give us a very good lesson learned that everybody can remember and be able to use the lesson learned from the first impact of the coronavirus in Thailand that might also useful to dealing with these pandemics in the near futures. So in this webinar, we are having four specialists in the healthcare system and also the One Health organization that joining us. First of all, I would like to introduce to you Dr. Liviu Vedrasco from the World Health Organization Thailand. And second speaker is Dr. Chatnarin Metheekul from the Faculty of Medicine, Thammasart University. And the third is Dr. Thanawat Tiensin. He is the permanent representative of the UN agency, FAO and IFAD in Rome, Italy. And he is also the chairman of the Food Security Committee of the UN agencies. And we also have Dr. Sutayut Osornprasop. He is the specialist from the World Bank healthcare program, and myself is Voravate Chonlasin from AIT Extensions. I'm working in AIT as the senior program specialist. So to mark the opening of these webinar sessions, I would like to invite Dr. Jonathan Shaw, the Executive Director of AIT Extension, to give the opening message, please. So Dr. Shaw, please.
Thank you, Kun Voravate, and a very warm welcome and good afternoon to everybody in this latest AIT Extension webinar on what made Thailand win the first wave pandemic fight. Lessons learned for the next fight from perspectives of wholeness, One Health and disaster response. There's an awful lot of content in that title, and I'm sure that our experts this afternoon will be unpacking that for us and looking at what that means from the perspective of Thailand. Of course, all of us here in Thailand have been here since the beginning of the pandemic. And when we first heard of COVID-19, we were aware that Thailand was, I think, the second country in the world that actually registered cases after China. Since then, we've watched with fascination as Thailand has successfully tackled its incidence of COVID-19. And at present, I think there are more than 100 countries in the world have more cases than Thailand, and many, many more countries have more deaths. So I think the world is finally waking up to the fact that Thailand has done much right in its fight against COVID-19. And that's not really a surprise. Everybody knows that Thailand has one of the best public health systems in the world. But in the early discussion on how to combat COVID-19, very few commentators actually noted the success of Thailand. Everybody heard about the success of South Korea, of Taiwan. Later, people paid attention to Vietnam, to Hong Kong. And Thailand somehow slipped under the radar. And I think, therefore, it's a very opportune moment now to consider exactly what Thailand has done right. And I think that everybody, certainly all of us here in this webinar, have opinions on what has been successful. But I think that this session this afternoon will help us to provide evidence for Thailand's success, and hopefully where that can be replicated as we go forward. I'm just back from Chiang Mai and Koh Samui, where I've been able to take some leave for the first time this year. And the economic impacts of the crisis are very apparent for everybody in those places. Thailand, of course, has prioritized getting healthcare right before the economy, on the understanding that it can only get the economy right if it deals with healthcare first. And so, in a sense, I think Thailand has taken perhaps a more extreme approach to tackling the crisis than almost any other country in the world, because there is probably no other country in the world that is quite so dependent upon the global economy than Thailand, both in terms of tourism, manufacturing, import, exports, etc. So I think that we're in a fascinating place. We're looking forward to hearing some extraordinary inputs and insights from our panelists, and we look forward to a very productive and engaging afternoon. Thank you very much. Over to you, Kunjo.
Thank you very much, Dr. John Chaw. Thank you very much for your opening message. I would like to brief the audience a little bit on the process this afternoon. We will also allow you to type your questions in text. And those who would like to put your voice questions, please feel free to raise your hand, put the button on raising your hands. And then our administration back at the production station will switch on and allow you to raise questions, verbal questions. All right. So I will guide you when we are going to receive the question from the audience. Now let's come to the talks, and perhaps the first questions is going to Dr. Chatnarin, since he is teaching in the Faculty of Medicine and also Public Health System Innovator. What is in the system of healthcare in Thailand that we can see that can help the minimization of the impact of the pandemics? What is your opinion? What is your view on this, Dr. Chatnarin?
Okay, thank you, Mr. Voravate. I think that your question have its correct point from the beginning, because it is a matter of first the system, and it is second the matters of how you do the service. I think that there are three key points. The first thing is adaptability. Because this is like a new normal for everyone. So if each nation or each healthcare system adapt more faster, then the successful rate is promising. The second point is about execution. Like you see that there are not just like execution in the healthcare sector, but it is also from adjacent sector, from the social sector, economical sector. So this type of execution throughout these sectors have to be synchronized. We can call this like holistic execution. So in the 3 points of synchronizing, these things are on 3 S. The first S is about, is it sensible or not? We can call it sensibility, to make the people getting on the right track, agreeing on the same method, or negotiating on the things that could be performed. The second S is about the sensitiveness, because sensitivity, sometimes cultures, religious belief, or sometimes the norms also influence the way or the method of the service provided and the culture of each nation. So if we have like a maintenance synchronized on measuring the difference of each nation's sensitivity, that is also make the good results. On the final S, I think is about specificity, because in Thailand laws, I think there is like specific roles implied or given to many counterparts, and each of the counterparts just be whole and strict to their roles. This is like quality control, and I think this makes Thailand just pass the first wave of this pandemic.
So you mentioned that there is a part of the execution. So can you raise some example in terms of the how in Thailand executions of the preventions or fighting the disease, or try to minimize the impact? What is the execution which is happening in the field or in the organization that is taking place that make the impact lessen than we expected?
Okay, for different counterparts in different sectors, at first, like if the health sector advise social distancing, advise how you have universal precaution, it cannot be maintained or be successful if it is not being cooperated by other sectors like the workplace. Like you are saying that, okay, work from home in theory, but in reality, no one can permit from the organization for their employees to work from home. This could not be successful. So sometimes implying of the law, implying the way of life, sometimes it's just new normal. But in the previous period, Thailand maintains to negotiate and trial on a trial and error. And we learn from what we have just practiced. This could be an example about different counterparts. But in the healthcare sector, we have a very strong alignment of primary care, secondary care, and tertiary care, in which in many nations, like a primary care is just like for entering the primary care unit or into the just superficial community level. But Thailand's primary care, we have healthcare volunteers, and we have like community health station in all of the districts in Thailand. And this is an important workforce from the past 5 decades and until now.
So I think the message is that Thailand somehow is very lucky that we have, so to say, a strong foundations of the healthcare system, where it's allow all the organization that involved in different layers like national, subnational, and also at the community layers can work together, and they have to play their roles based on the problem that they have to face. Secondly, there is the linkage between the primary care to the secondary care and also the tertiary care, where it is already facilitated the measures that they are to fight the coronavirus. So that is like a given to the system, where there is a situation happening, a pandemic is happening, so that the people inside the organization that already setting is already ready to move forward with the response to the crisis. Dr. Liviu, Vedrasco, what is your view on this? What your takes on this in terms of the system in Thailand from the viewpoints of the World Health Organization, and you are working in this field? What is your reflection on this?
Thank you, and Swadee Krap, Kompo Krap for invitation. Very, very honored to take part in this discussion. So to start with my views related to Thailand response, and a lot of my views will be resonating with the previous speaker. From very early on, Thailand adopted an early and rather comprehensive strategy. That was at time challenging for all of us, local and international observers, to grasp and understand, since it was not initially in February and even in early March, it was not presented as a comprehensive plan, but driven by announcements, orders by Ministry of Health, from Minister Office, other authorities, until later part of March, when the establishment of CCSA was in place and now leading the response. Now, I think also Thailand's strong universal health coverage is a real advantage, and is truly a foundation that made the mounted COVID response possible. Yes. It is important to highlight that the primary healthcare network that reaches and is accessible to everyone living in Thailand, even in the most remote communities, that is a result of decades of investments. This was not put together in February or March. Also, it is important not to miss the excellent laboratory capacity present in Thailand. And maybe the fact that Thailand was number 2 in the world to report a case to WHO is not because Thailand had, the second country in the world had the case. No way. It is because Thailand had the lab. Thailand had the scientist who worked for, I think she worked for 15 years on coronaviruses. So the excellent laboratory capacity present in Thailand is a core added advantage that allowed the response from early on in January to be well equipped with one of the key weapons. Unfortunately, we don't have a full arsenal of weapons, but we have some. And we had this weapon to fight this pandemic, and it was timely and accurate testing. And without the testing, we could have not found where the virus was. We do not know who to isolate, who to quarantine, who could be the suspect case without knowing it, and who can potentially spread the infection to the community. And lastly, let me also just resonate with another point, and that is to pay tribute to the million village health volunteers. And also, not just the million health volunteers, it's the millions of community members that respect them, that listen to them, that follow their advice and support their critical mission on the ground. Because you can have volunteers, but nobody pays attention to them. This is the real interventions that were to be deployed in every community, every family, each individual. And that is a tall order. This provided a real advantage for Thailand, as very few countries in the world held this army of volunteers that have not just been recruited overnight. Yes, some will say, oh, Thailand pays a little bit to these volunteers. Okay, fine. Okay, you go and recruit 1 million and pay them. And actually the payment is very little. So it's really not a salary. It's, I think they can truly be called volunteers. Nobody can question that they are salaried government workers. So they have existed in Thailand for decades as part of the fabric of Thai public health system and the society at large. Let me now turn a little bit to challenges, because otherwise people will say, oh, you're painting a rosy situation and everything is wonderful, and Thailand just have to like teach the whole world and you know, relax. No, there are of course many challenges, and I don't have time to address all of them. One such challenge relates to over 3 or maybe 4 million migrant workers that do not have ideal access to healthcare and information and face multiple obstacles, including insurance, language, marginalization. But to the credit of everyone involved, both Ministry of Health and WHO and other UN partners, they worked hard from the beginning to address this through many interventions, including a specially dedicated hotline in like 4 different languages. And this brings me to another positive aspect of the Thai response, and that is reaching people with information. From the beginning, the Ministry of Health, the DDC, was the main communicator. So the main communicator was changing, which is fine. Nobody knew in January what that was. So the COVID 1422 hotline is one example of that clear communication. The Ministry of Health and Royal Thai Government, CCSA, uses many other platforms to reach out beyond publishing the online and tweeting. So this provides regular updates to the public because the public needs to know, should they overreact, should they relax? So I think these daily briefs serve as a very important, and I hope they will continue. I'm sure they are changing now, not daily, but still, I think this is an important aspect. Yeah. And moving forward, probably over the next several years, it's important to maintain the same level of agility and the same level of unity and cooperation by the Thai government, private sector, civil society. And the task at hand facing Thai society and every other country in the world is not easy. You have to save lives, not only related to COVID infection. Other people didn't all stop dying and being sick. So you have secondary and tertiary indirect impacts. Hunger kills very much. Lack of a job and no money kills through different pathways. And to reduce such other impacts, one must reduce the disruption to the socioeconomic life without compromising measures to control COVID. This requires a whole of government and a whole society approach and movement that I can describe later on if you want me to attempt answering some issues related to the global challenges and solutions.
So yes, Dr. Liviu has touched upon in terms of the healthcare system where the health volunteers working at the grassroots level is playing very important role in helping the people in the community to be able to understand the crisis and also the preventions to the pandemic. So how does this work, Dr. Chatnarin? I mean, what is the medical care in the grassroots level that we can also giving giving expectations that the health volunteers can also represent the healthcare system, that Thailand was so ensure that this would somehow raise the confidence and security to this pandemic. How did this work at the community level?
Okay. At first, like Mr. Voravate, you have mentioned that is it considered that Thailand is quite lucky? Well, at first we are 50% lucky. 50% is from the establishment of the universal coverage for about nearly 3 decades. But when we talk about luck, it is a very unique example for Thailand's healthcare volunteers, because when we ask about how old are they are above 60. 65, 70. And how are these going to help if we talk about the task force? These are aging population. And how can they help the healthcare system? To our luck is that when we give out like a small token for volunteers like that, but we also give them what we call healthcare indicators, in which the good point of indicators is that what they perform is like a smart working. Do not work a lot, but still you get the point that you need to stress on the community's health. But then it means that if a lot of indicators or KPI like that, it means that they have to be a full-time worker. And then who can be volunteers? It must be someone who are already retired. So it means that is why the age of the the healthcare volunteers in Thailand are almost 50 up, and mainly above 60 who are already in their retirement. But what are the benefits of this? The benefit is that when they are healthcare volunteers, it is just not like one assignment. They have to continuously be trained to like a refreshment of knowledge of self-care, community care, as well as sometimes they are part of the SRRT team, Surveillance Rapid Response Team. So at this point, it means that in every type of outbreak, the elderly are the ones who are primary at least. If they are also healthcare volunteers and in their groups, in their communities, they themselves gains much of the knowledge continuously from years to years. That is what we call our lucky point. Because instead of when there is outbreak and you give the knowledge and the practice what should be done to the elderly, you already give them when they act their role as healthcare volunteers already. And when these are like a community leaders, they come and when they go to like in the village or in their neighborhood, they are being respected from their caring for the population in that community. That is why they have influence. They are a person of impact factor.
Right. Yes. But when it's come, Dr. Liviu, when it's come to very dangerous diseases, and how the volunteer openly, accept that they will joyfully fight this disease with others. I mean, they have fear on that? Do they have reservation? What make them, ready to fight? I mean, that is, of course, one is the cultural factor, but it may not have in many countries like that. So the curiosity is that how make these people to stand up and also fight with other organizations or other specialization, I mean, professions.
Okay. For the volunteers in Thailand, I think that it is the point that we are trained for universal precaution. In my opinion, that is the first point. That is why they are confident in doing this job.
Right. Right. So, okay, coming to another perspective, maybe, and Dr. Vedrasco has mentioned about the laboratory equipments, and that is, Thailand has invested already there. That's why the service and also the diagnostic part is already there. So, in terms of the preparedness for the disaster response, because this pandemic is something very new to Thai society and also the many communities in Asia. So what is the in perspective of the disaster response, Dr. Sutayut, that Thailand has to face and also have to adjust themselves to deal with this risk in a different way that they have been dealing with floods or droughts or tsunamis or many others.
Well, thank you very much, Dr. Voravate. Yes, I actually, my messages very much echo what has been mentioned by Dr. Chatnarin as well as Dr. Liviu. There are factors, key factors that contributed to Thailand's success in responding to this COVID-19 crisis. And we can say that disaster preparedness, particularly for the health sector, health-related ones, is also crucial. And the first factor is I would like to say that the government is focusing on expanding the COVID-19 laboratory capacity nationwide with the clear criteria of patients and the investigations for all healthcare providers to identify who can get the test from the beginning. But I have to say that it was not without problems. In the earlier stage, in the earlier months, in February, in March, there were a lot of hiccups. We probably have heard that there was a shortage of reagents. The PCR test, which was supposed to only take 6 hours to deliver the results, wasn't possible because of the lack of reagents. And then the patients at the time had to wait several days, sometimes as long as 6 days, to get the test results. So that's actually it affects the whole process of the confirmation of the cases, which would lead to contact tracing and other isolation, quarantine interventions. But that was the past. I mean, what I'm very impressed is the speed in increasing the laboratory testing capacity in Thailand. It has been remarkable. Within a few months, from very few labs that could conduct the test, it has been extended to all the provinces. And now there are actually over 200 laboratories across the country that can conduct the RT-PCR test for COVID. And the government further expanded the testing to all the risk groups nationwide. So I think this is a very important principle. I mean that proactively conduct the test among the groups that are likely to have COVID, particularly these migrants that might move across the provinces, we don't know. And we know that Thailand borders can be porous, so people can move in and out from neighboring countries. Could be from Malaysia, from Myanmar, from Cambodia, from Laos. And so the expansion of the test to migrants is also, and other at-risk groups are very important. Second, much efforts have been made for contact tracing to identify the people who were in contact with the COVID-19 patients for testing and quarantine. And I think it's about learning as we go. Initially, Thailand also faced this situation and didn't know how to do effectively, but later on we know. And partially, I mean, learning from the practices from China. The use of the Thailand app, for example, the enforcement of the contact tracing has proved to be critical to help halting the spread of infections. And what is actually can be used as a good example is the Rayong incident, which all of us know from the news because of the team of Egyptian military visited, and one was found with COVID. And with contact tracing system in place, it was able, the government is able to actually identify over 1,700 people, okay. And then get them very swiftly to conduct testing. The third point I would like to mention on the isolation and quarantine policy. And again, this is something that we learn as we go. The isolation quarantine facility has been expanded over time as well, not only in hospitals, but also to actively create hospital which is the accommodations for patients who need recovery and continuing isolation, adapted from hotels to help reduce service pressure at hospitals. And we noticed also that this 14-day state quarantine policy that has been in place, except for a few hiccups, it has so far worked well. Fourth, this is the well-integrated healthcare system, as our two previous speakers has mentioned, with a very strong primary care and as a front line for health service delivery. This is very important for us to actually tackle COVID. The seamless referral systems between primary, secondary, tertiary care levels and the UHC is very important. The availability of these village health volunteers, which are about 1 million of them, they play a very important role particularly on the disease prevention side. I would like to say that prevention is so important. I mean, you have these people knowing the households in the villages very well and educate the villagers on health promotion behaviors, wearing masks, hand washing, social distancing, and help the government and health facilities to conduct contact tracing. These are very important. And I have been working at this time, I mean, in the Philippines with a very decentralized, unintegrated, uncoordinated healthcare system. I can really see a very big difference between what is happening there, how the COVID has spread very fast in the Philippines and Indonesia, while Thailand has been able to contain it. So the health system actually is very vital. The fifth point, the efforts have been made to prepare for more ICU units in the country with the adequate provision of the PPEs, medical supplies, medical materials at health facilities. And very interestingly, that Thailand has also invested in producing the PPE itself. I mean and as we learned that a lot of the industries have converted their factories into producing the quality PPEs, and now actually Thailand has a surplus of the PPEs that we can't even export to other countries. And this is quite important because during the time when all the countries in the world are facing the COVID-19 crisis, there is surge in cases. In a number of countries, there is a shortage of PPE. So the fact that we are able to be self-reliant is actually a very helpful factor. Yes. And next, the extensive information campaigns on COVID that the government has done from the beginning, how people could protect themselves, wearing face masks, hand washing, social distancing, it is so important. And also the Thai culture of greetings in the way of why instead of kisses, handshakes, it also could help prevent the spread as well. The other factor that I like to mention is the government and the academic communities in Thailand have strived to invest in research and innovation to improve the country's capacity and to produce vaccines, medicines, medical laboratory supplies in order to respond to COVID. We are now able to produce the RT-PCR reagents, so don't need to rely on the imported ones. The development of the vaccines is on the way. The government, pharmaceutical organization even started the development of favipiravir, which had some evidence of its use in treating COVID patients from China. So these are some of the very innovative innovations that the government has supported and the Thai people have done in order to help respond to COVID. But it's also good to hear from Dr. Liviu from WHO how this the production of the favipiravir is going to help Thailand in the future. I have another important aspect that I would like to mention here. It's about the implications of the COVID-19 crisis on a country's people, physical and mental health, as well as the health system. And this is not just Thailand, but also for other countries as well. And we know that the COVID crisis has significantly affected the people's physical, mental health in many, many countries, especially the poor, vulnerable groups who are already facing natural disasters, stagnant wage growth, rising poverty. And now as economic activity declines, job and income loss will likely worsen household welfare, including their ability to pay for the bills, satisfy basic needs, including health. And so beyond the direct impacts of health of the people who are affected by COVID, there are also indirect impacts on the physical health arising from the COVID pandemic. First, looking at the supply side, healthcare services are not operating at full scale in many countries. While the situation varies across hospitals, it is clear that many non-emergency, non-COVID-19 healthcare services have been postponed or cancelled, including elective surgeries. Many hospital wards have decided to reduce the number of their patient appointments significantly, some by half or more. Some non-emergency wards have been closed totally. So it is not only because there are health personnel who have been transferred to support the COVID patients, but also due to other social distancing and patient safety measures implemented to reduce the risk of COVID infections in non-COVID-19 wards. And second, on the demand side, patients who usually require care at health facilities may forego seeking care for fear of contracting COVID-19 from the health facility visit. So this can lead to worsening health conditions, which unfortunately might lead to more complicated or expensive treatments later on. And third, health promotion and preventive cares have been affected. For example, the selected non-communicable diseases screening as part of NCD prevention control measures have been delayed. And if the COVID-19 situation continues, such important disease prevention services, immunization, vector-borne diseases, prevention and control, they could also be affected. Another interesting point I want to say is that lockdown and curfew policies to contain the spread of COVID also have potential impacts on people's physical as well as mental health. Opportunities for physical activity are limited when people opt to or are required to stay indoors, and people's dietary behaviors could change when they are mostly at home. So if prolonged physical inactivity together with possible poorer nutrition can also lead to higher rates of overweight and obesity, which are also risk factors for the non-communicable diseases. Finally, I want to stress that the public health financing for these priority interventions are supported by a strong healthcare system with good referral network could be scaled up as needed in response to the COVID situation. And it's crucial not to neglect non-emergency, non-COVID-19 health services, particularly the cost-effective health promotion and disease prevention interventions as immunization, maternal and child care, nutrition, prevention for vector-borne disease, and NCD screening. So let me stop here and happy to answer the question. Thank you.
Very interesting, Dr. Sutayut, but all of these need money and need the budget, and budgets and monies for the government always having a limitation, and also very difficult to remobilize or rearrangement for this. So what there that make the mobilization of resources and also reallocations of the budget can be responding very fast to this crisis. Dr. Liviu, do you have any comment on that? How the one government would prepare for how to make the mobilization of resources for laboratory, for testing, for checking fast, so that they can respond fast? Any observation on that?
Sure. Let me because you are asking me something that doesn't necessarily relate to Thailand. So that's a very good segue to switch to the global level. And you mentioned the crisis is unprecedented, and I just want to use a few seconds to quote the UN Secretary General Antonio Guterres, who said the COVID-19 pandemic is one of the most dangerous challenges this world has faced in our lifetime, in his lifetime too. He's not a young fellow. So that is a strong statement, and that was echoed by other leaders. In other words, for example, Angela Merkel puts the COVID crisis on par with the Second World War. This is coming from the head of state of Germany, comparing COVID to Second World War. So these are strong statements.
Okay.
So how do we deal with this crisis in the future and now? How do we ensure an adequate global COVID response that is united? So we cannot do it without a whole of society response. And everybody's using this, and sometimes one might say it's, I'm sorry, I had some noise in the background. Now it's off. So I think many people left and right are saying whole of society response, whole of government response. But if you stop them and say, hey, can you explain to me what you mean? Usually they're like, they ramble a little bit. So let me try now to spend 2-3 minutes not rambling and trying to demystifying and unpacking what I feel and what I think the 5 principles that would apply both to global and national level that comprise together what we could call whole of society, whole of government. So number 1, all 3 elements of society have to work together. What are these elements? No matter you're Thailand or Zimbabwe, it's the same elements. You have a government. So far, I don't know any countries without government. Sometimes it's complicated, but they have a government. Then you have private sector. Okay. Then you have civil society. And in this, I include all kinds of forms, including religious organizations. And all of this must work together. All of this have to sit together and agree on how they work together and what the interventions are and communicate them to all in a coherent message. It doesn't mean one voice. It can be many voices and many channels, but one message. So this is number 1, all 3 elements of society. Number 2, we have to be ready at all levels. We cannot have a magnificent plan written and it's at the central level or in the province. From the individual to the household, to the village, to the district, to the state, all the way to the head of state and the global leadership, including UN and religious global leadership and corporate leaders. They all must be involved now in the response, and they should have, and some have been involved in the preparedness, and they have to be ready. They have to be ready to play their part in the response and agree how they work together. You cannot do it overnight. So this is like village health volunteers. So you have to have it in advance. You have to act, you can activate it, you can improve it, but you have to work on it. Number 3, it's also universal. It's you have to pay attention to critical interdependencies. Again, no matter Zimbabwe or Austria, pretty much you can have 40 ministries, you can have 12 ministries, but you pretty much have 9 essential sectors. You have food. We have FAO here. So you need to eat. Then you have water and sanitation. Then you have energy. Then you have healthcare. Then you have telecoms. Then you have finance. Then you have law, order, and defense. Then you have education, and you have transportation. You can name me 10 more, but these 9 cover all, pretty much encompassing how the society runs. And the failure in one can have major social consequences that impact other sectors, including health. So you have a disruption in transportation, like you are banning all flights and you want PPE. Forget it. If you ban all flights and then you want something, then it doesn't work. So each sector must be ready to play their part in the response and agree in advance how it works together with the other 8 sectors. And all sectors must have and use the same recipe book if you're a cook. But if you're a general, maybe you have to have the same game plan if you want to use another metaphor. So together their goal, what is their goal? Their goal is to minimize disruption and maintain what many have coined the new normal. I don't like it, but anyway. Many argue that the old normal was not something we should strive to go back to. So So new normal doesn't work. So this is number 3. Number 4, we need to adapt a severity-based response. I will explain what this means. Did we do too much too early? Or did we do too little too late? This is a delicate, yes, I'll bet it's philosophical, but unavoidable and practical balancing act for governments in dialogue with the other 2 sectors, 2 blocks of the society. So it is appropriate to develop and plan for different scenarios using clearly defined planning assumptions. And it is prudent to plan for the worst and hope for the best. And lastly, number 5, we must respect ethical norms.
Okay.
We cannot do without ethics. I mean, we cannot just say, oh, we'll just protect the economy, you know, GDP keeps stable. Okay, some people we let 500,000 die. Okay, everything is running fine. No, we cannot do that. Responses should be consistent with universal and national ethos, ethical norms. And governments should identify and protect. They have a duty of care to protect their vulnerable groups who tend to be overlooked. The refugees, the migrants, the disabled, the elderly, especially those living alone, the homeless, the prison populations. We must not forget them.
Thank you very much. I know that Dr. Sutayut will have to leave soon, but let's come back. Let's come to another perspective in relation to the well-being and also sustainability. Dr. Thanawat, is this pandemic, disturb the global effort on the SDGs? Is that giving any challenge to the UN agency, FAO, IFAD, in order to drive the well-being of the people and food security? And is this affected that? And what change that the UN agency and UN committee have to reshape the policy in the future in order to deal with the situation that's happening today?
Thank you very much for invitation to join this talk this morning in Rome and also afternoon in Bangkok. As other speakers, Dr. Sutayut and also Liviu already mentioned that COVID-19 is not only health crisis but also create any other impact and consequences, and we can say that COVID-19 it really opened our eyes, and not only health public health service is being tested, but also other systems are being tested as well. For example, like food system and others. As you know that at the beginning of the COVID-19, I think most of the country have the same. People get shocked, people are afraid, have fear, and we have seen a lot of situation that people went to supermarket to buy food, and we see the purchase shock, all the food in supermarket is gone quickly. And that's why this one is a real impact that we have seen. But we know that when the time is the situation of the disease is moving forward, we know that people are adapting themselves, and they learn that we, in particular in Thailand, which is a food producing country, and we have a strong local food system. Sometimes people don't really much care in Thailand that because when you go out, you can buy food, you have a food vendor. But in other countries, they don't produce enough food, especially the countries, landlocked countries, or country in the conflict or civil war. They don't have enough, and that's why during the crisis, during last 6 months, here in Rome, which is let's say is a capital of the United Nations on food and agriculture, that we have the Food and Agriculture Organization, FAO, we have the World Food Program, WFP, and IFAD, International Fund for Agriculture Development. One of the issues that we are discussing together with members and also together with WHO, we try our best to prevent crisis in the crisis, because we don't want to see health crisis at the moment that we are facing, and also followed by food crisis. Because just last week, when the UN, actually the Secretary General of UN, Mr. Guterres, together with others, head of the UN agency, as I mentioned earlier, we just launched the report of the state of food securities and nutrition in the world for 2020. And the numbers already show that the world is not on track to achieve SDG or to have a zero hunger. And especially when we have the COVID-19, it worsened the situation. This year we will add up 132 million people are hungry and undernutrition all over the world. That's why, as some of you already mentioned, during the situation, it's a time to learn our experience from each members from different countries. And also we learn from our failure, we learn from our mistake, what we did at the beginning. And that's why it's a time to cheers. And also we know that the pandemic may continue. And also we may have the new emerging infectious disease in the futures. And that's why we need to prepare ourselves. We need to prepare our system, the health, public health service system, and also other systems to make sure that we have a sustainable system to face with the situation that may occur in the future. It's the same as the food system. We know that now we know that our food system is broken because during the COVID-19, when the borders of each country closed, the truck cannot go, cannot pass to the borders. Other countries who are waiting for food, they are struggling. For example, like in Laos, in Myanmar, when the border closed, the trucks can cross the border just only 2 or 3 hours according to the regulation of Laos and Myanmar, and how people can get food. And that's why during the crisis, all the members and also we are discussing how to make sure that we facilitate the trade, international trade and regional trade. And we also can bring food from one place to another place, because we don't want to see food crisis after the health crisis that we are facing at the moment. And that's why it's a time to share our experience. It's a time to fix the problems. It's a time for us to make sure that we learn what we did wrong. We learn from our failure, and then we can do more to make sure that we will build back better for the futures, not only for health sectors, but also for the food system at the national level, regionals, and global level.
So just a quick question to Dr. Thanawat. Being the vet yourself, how do you see this, caution that the world has to pay attention to the linkage between the diseases that might coming from the animal, and that maybe in the future might also affect the human being. So what you see on this in the future? Is there any big risk that we have to patrol more, or anything like that you would like to share your view?
Yep. As a veterinarian by training, and actually just last week, because I also in another capacity as the chairperson of the UN Committee on World Food Securities, you know that during last month, when we have a cluster outbreak of the worker in slaughterhouse or food processing plant, it brings fear, and also people are discussing about food. It may spread the disease and whatever. And that's why we know that most of the emerging, 70% of emerging infectious disease come from animals. And that's why as currently, I think all over the world and also WHO are promoting, we are promoting the One Health concept, how we really look at the issues or interaction between animal, human, and environment. And that's why I think in Thailand is we have been practicing the One Health concept for many years. Actually, before I came here, I also is a part of the One Health initiative. We know that this concept or this approach will bring all, let's say, all the people and also facilities and infrastructures from human health, animal health sectors, and also eco health sectors to make sure that we really taking care, and also we look all the issues that have the interaction, and also how we can prevent those emerging diseases together, because we know that sometimes some issues, especially when we, for example, right now in Netherlands and also in Spain, when they detected COVID-19 coronavirus in mince farms, and also it become another fear that people are afraid of, and that's why working together and also join our effort, it will help, and also I think we will cope with this situation.
Thank you very much. Dr. Sutayut has to leave. So what is your final message, Dr. Sutayut, in relation to the lesson learned from Thailand that we perhaps pick up, and also this also maybe have some benefit to other countries that trying their best to fight this coronavirus?
Thank you very much. The telemedicine has proved to be very effective to support the expansion of health service delivery to remote rural areas where there are no health facilities or health workers. And Thailand, Thai health facilities also have initiated this telemedicine initiative in several health centers in the past, connecting health centers to district hospitals where there are doctors, and then the patient do not need to travel a few hours to the hospital, but can be at their village. The health center is in their village, and then connect to the doctor there. So this actually offers a great potential during the COVID-19 crisis, as it offers the opportunity for the patients to receive medical consultations with specialists without the need to visit the health facilities and risk contracting COVID. It also helped reduce the number of patients arriving in health facilities. So it helped on both sides. But this initiative also comes with challenges, because we know that during the crisis, there's a lot of telemedicine operators rising, growing very, very fast. And the challenge is the lack of regulations, which might allow some professionals to take advantage of telemedicine. They could give inappropriate advice, why overcharge patients, for example, or the patients may not be in the position to decide what kind of symptoms, what kind of diseases that can be done effectively through telemedicine and what cannot. So there are some certain symptoms, certain diseases that they really need to actually visit the health facility, and they need to be, they have to actually be informed on that. And so the stronger regulations on the telemedicine services are needed for the future. On my second point, I would like to share with you regarding Dr. Voravate's questions about how to ensure financing is available to address the crisis. But what I want to say is that once there is crisis, like COVID-19, there are always ways for the government to mobilize money to actually respond, and not just the government, private sector, and the development partners as well. So once there is crisis, it is not difficult to mobilize funding from several sources. But that is not the most important part. What is more important is the preparedness and financing for preparedness to prevent the crisis from happening. is the most important, and it's actually the most cost effective. It actually saves lives, saves cost, and something that the world, many countries in the world have not done enough. And the World Bank, as a team, that we have prepared health security financing framework, which maybe I take the opportunity to share with you briefly on the screen. Yeah, so this is a framework that I and my team has been working together with WHO, with FAO, USAID, and the governments of Cambodia, Laos, Indonesia, and Vietnam and Myanmar to develop this. It actually helped provide the framework of what is needed to mobilize the resources to ensure the ultimate goal, which is to strengthen the systems to achieve universal health security through adequate and sustainable financing. And the focus is on preparedness financing, because we know that the response financing can be mobilized much more easily, but preparedness is not, and we need to pay more attention to it. So the suggestion that we provided to countries to strengthen this is that first, there is a need to assess the current financing for health security. And then the second step, identify and prioritize system bottlenecks and analyze additional financing needs for improved health systems and capacities for universal health security. And after we are able to identify these the key priorities, bottlenecks, then we can define the financing options and integrate this into the national fiscal framework, the medium-term expenditure framework, and sector plan and budget. And while doing all of this, at the same time, we need to increase the awareness on health security and economic risk and return at the national, regional, and global levels. And the most important message that I would like to leave here is that health security is not just about health security. It is economic security. As we can see from the COVID-19 crisis, the impact on the economy is so great. And this is a good, in order to inform the governments that we need more budget, more financing for health security. So making economic case, using the examples of the COVID-19 crisis, examples of the Ebola crisis, the impacts on the whole economy, and use it to mobilize more sources of funding to support preparedness activities. So this is my final suggestions, and I really hope that will be useful, what we shared today, and thank you for the invitation.
Thank you very much, Dr. Sutayut. Thank you so much for your time. So, Dr. Chatnarin, what will be your suggestion to the audience? What would be the lessons that we have learned from Thailand that maybe the colleagues, audience would take away, and maybe in what way that they can convey this message to the responsible organization to perhaps consider the lesson that we learned from Thailand, that to improve the situation, to make it faster or better than today.
Okay, all right, thank you, Mr. Voravate. Because as mentioned, I think I will leave about 3 or 4 points. The first point is that it seems to be that Thailand is fortunate to have the universal coverage, but in fact, the synchronization of primary care, secondary care, and tertiary care in Thailand is far beyond that period. So it means that in many countries which they have no universal coverage until now, it is still capable for them to define what is the strong points in making coordination between these 3 levels of care, in which if there is coordination between these 3 levels, COVID-19 or any other infectious disease is not looks so dominant for us to take care of. This is the first point. The second point is that although we do almost perfectly But I still think that this is just a battle of 5 or 6 months. So it means that 5 or 6 months in the long run, what we call is that we might have in the military, they would call it battle fatigue. So it means that in Thailand nowadays, even though the situation of COVID-19 is quite controllable, but the Ministry of Public Health as well as private hospitals, they also have a long plan because due to the prediction that the overall world situation might not last until the end of next year. So at this point, our doctors, our healthcare personnel, and our comrades, they work in rotation now. So it means that we are saving the workforce to avoid what we call is maybe burnout, or in the military, we would call it battle fatigue. This might be a little bit essential for many countries that they have limited resources on this. The third point is that in Thailand, we have a plan to be several hubs in the world, food hub, medical hub, tourism hub, and still it is always like having negative impact from the COVID-19. In educational hub in Thailand, I think Thailand have many role models in prevention to a more serious situation of COVID-19. That is, we could be a training hub for healthcare volunteers, like to be a situational scenario for other countries to work upon why Thailand is successful on this point. The other point is the doctors in Thailand, when they graduate, they follow the protocol of the 5-star doctors of WHO. It means that when they graduate, they are not just healthcare provider, they are trained in administration process to be manager, to be communicators and community leaders. So at this point, it is quite an interesting point that how we prepare the workforce of Thailand medical sector is not just through management of the Ministry of Public Health, but it starts from medical education. And finally,
yes.
on the fourth point, I think that we might be performing well, and everyone says that we have lessons learned. But for Thailand in particular, is that we have many lessons, but sometimes the pitfalls, it still happens again. So it means that we have to take this more seriously, that even though we are doing fine in the overall outcome, but there are details, like we said, devil is in the details. There are details that we have to make a quick correction. We do not leave this out. So if we want to overcome the next battle or in the long run of other infectious disease, I think the situation in Thailand should not be talked upon only the point that we are successful. We should also talk the point that there are some pitfalls which needs improvement also. That is my final point.
Thank you very much. Dr. Liviu, before we close, what will be your final key message to the audience today?
Thank you very much. And I have formulated 3 final, hopefully converging messages. Number 1, and these messages are for the Thai situation and the Thai actors. Number 1 is to keep Thai society COVID ready for another year, another 2 years, not relax. Number 2, address our priorities. Do not let things slip because of COVID. Number 3, continue with solidarity, compassion, and humility. And let me now just take a few minutes to elaborate on each one. So number 1, maintain the readiness. This applies to our country as well. Thailand had success at suppressing transmission, was able to reduce the transmission at low level and then eliminate it. And now recording just imported cases, I think 8 today in quarantine. And while vaccine research is accelerating globally and in Thailand, Thailand cannot afford not to remain ever ready for a resurgence of cases and maintain or even strengthen systems in place to quickly identify any suspect case, test the case, treat the case, isolate, quarantine, all the things that we know how to do and Thailand knows how to do and needs to keep this knowing alive. These centers have long been the bedrock of the outbreak response from smallpox to polio to Ebola and now COVID. It's important to act fast when we have a resurgence and use all these tools with no exception. Number two, and a few speakers mentioned this, it's we must not put everything else on hold. Life cannot be put on hold. If you put too many things on hold, other people will die. So while we're tackling this pandemic, we must not lose focus of other pressing health needs, and not just health, other societal and economic priorities. We must not put everything on hold. It's like it would lead to an even greater disaster. I would like to use the analogy of tsunami that follows an earthquake. So you may control the earthquake and everything, the rubble, nobody die, and you don't mention that the tsunami is coming. So we must prioritize other things as well, and including immunization. You mentioned TB and many, many other things, and not just health. Yes, I am a public health practitioner and I'm a doctor, but I'm a strong believer that there is not just health that makes people alive and happy and healthy. And the health only approach is not the solution. So lastly, number three message is to continue with Thai solidarity that you showed from the beginning, with a compassion which is in your DNA, and the humility, as the last speaker mentioned. Don't just say, oh, we won, we're successful. So I think Thais are it's really in their DNA, these three things. And this must continue to unite everybody, crossing ideologies, and also crossing other visible and sometimes invisible lines between people and groups. So these are my three messages. I hope they're very clear. And lastly, I want to thank the organizers and the audience and mention that such exchanges are invaluable, as the science behind COVID and pandemics in general is ever expanding. And what we know today, what we know in September is not what we know now. So we have to stay agile. We have to stay ready and keep learning. And such opportunities is a wonderful way to keep this going. So kapung krap.
Thank you very much. Dr. Thanawat, please.
Okay, thank you again. I want to pick up some words that previous speaker mentions. Our life and our societies and our countries will be moving forward. Health crisis is just only another crisis that we are facing. But we don't want to have other crises that follow us, whatever socio-economic crisis, food crisis, which will bring the situation even worse. And that's why the decision that had made, there is nothing perfect, 100% perfect. We can make mistake, but once we know that it's a mistake, we need to fix, we need to revisit, we need to review and to improve. And that's why during the situation, we can say that the crisis always gives us an opportunity to learn how to improve, to learn how to get ready, or to make sure that our emergency preparedness, not only for health, for other sectors also need to improve. And I just would like to give some key message. The first one, we know that all the solutions are in our hand as an individual, as a citizens, and also as a professionals. And that's why as we are as an individual, we are demanding healthy food system. We demanding, let's say, good public health system. It's not only the infectious disease, but the non-communicable disease that we have a lot of problems because of food, because what we are eating at the moment is not good at all. And that's why we also have to be aware of that. And second, our government and also our national leaders, yeah, they have their own responsibilities. And I know that they do their best to make sure that they can can bring better for the countries. And we also need to hold the leader and decision makers accountable for the outcome that we are seeing. As I mentioned earlier, we can make change, we can fix the issues, but we need to unite, and also we need to work together, and also we need to be patient. Sometimes we really need to be patient because sometimes we cannot change everything overnight. But anyway, I know that Thai people also, we are very patient. The third one, as some of you are leading the groups or the organizations, not as previous speaker already mentions, health is not everything, but they are also linked to other issues. And that's why the first three SDG, Sustainable Development Goal, the first one is no poverty, zero hungers, and the third one is good health and well-being. Because the first three SDG is really well connected. And if we can improve the first three SDG well, it will link to another 17 SDG. And that's why now we are demanding a very specific systematic changes. And also we need support of our leaders from our government, business, private sectors, health sector, food producers, medical professional, and others who have their responsibilities for today global, better global health system, and also for better food system to make sure that we have enough food to feed you all. Thank you very much.
Thank you very much. So I see one question from the audience, which is showing the worrisome about how we are going to balance between solving the diseases problems and the economic problems. So since the pandemic is prolonged, then how the government or somebody who are responsible to prioritize which one first, people life first, or you know, hungry first, even money, economy. So how would you see this in terms of the privatizations of the government and someone who are responsible between economic developments, sustainability, and the risk management?
Very volunteering. Okay, I think that it depends. This is like a tailor-made answer. It depends on the situation of each nation, or it might be each individual or each counterparts in the society. It might not be one correct answer that what you choose upon economics or upon health. But one thing is for sure is that health is not quite divided from economics, because what we say, health has three aspects. The first one is physical health, second one is mental health, and the third one is socio-economical health. So it means that either you think that you are choosing health, but if you have good health, it might not be a quick win, but it will make you be capable to run on your economical circumstance. But if we talk about in a more macro view, that is what I tell is a microscopic view. In a more macro view, I think that it depends on what is the current plan, what is the current situation of the organization, institution, or of the country. And you have to choose. But when you choose, it is like trial and error. even though by calculation, you can switch on rotation, you can change your decision. It is like there is no definite answer for that. But if you stay there and just, okay, what happens, it just happened, you will not survive. You have to come out with some types of solution, but it is not a promise that these solutions will work. But if you do it the old way, no change at all, you will not survive. At least you can change because the situation changed. Then what you perform must also change. Wait and see, learn, but then you must try. What you learn is not the thing that is promising your lesson will be effective for other person, other organizations' lesson. So
thank you very much. Yes.
Answer for that.
Right. So other audience, you have any questions, please raise your hand so that we can switch on the microphone. So I can maybe try to make a key points from the discussions today. I think the first one is in relation to the executive committee of responding to the crisis, or disaster management team at the national level. That maybe depends on how fast the regulations allow the committee has to be formed and be able to activate the strategies and measures to prevent the pandemic. So I think that is the government and also the regulatory role to play over there. The second part is the health system, that we have also to find the strong point of the health system that we can take advantage of in order to be able to respond to the pandemics of these dangerous diseases. In case of Thailand, we say that we are lucky that we have a very strong foundation of the healthcare from the national, from the subnational, and also to the community level. That's why this is very important for the prevention and also for curing of the disease and testing and laboratory work. So these are the things that may not be given in every country, but something that we have to think about from today, how we are going to address this as the whole system. The third could be the government strong message and also the enforcement of the temporary measures in order to put the people into the same discipline so that we can, the government can move forward with the actions that helping the whole countries, helping the citizen as a whole, not doing by piecemeal. So I think the enforcement of the measures and the operation of the measures that they are putting in place is very important. If we leave to the people behavior, people lifestyle, and also the awareness and culture, it may not work 100%. So we have to have a very strong commitment from the government side and also on the law enforcement side. As Dr. Liviu has said, the investing in the primary preparedness in terms of the medical equipment for the laboratory testings and also confirming the cases is very important. So this will equip the government and also the hospitals and also the laboratory to be able to have a minimal requirement to be able to detect the infectious disease. So maybe we have to look for the way that the government would have to mobilize resources in order to move that very fast. And last but not the least, and also is depending on the system, is the source of funds that the government can quickly mobilize. For Thailand, for instance, we have the universal care coverage as a source of funds that can be mobilized urgently in order to be able to get the resources for testing and for detecting. So maybe these are the something that we may have to consider as the health professionals and also as the organization, whether they are governments or the private organization, civil society organization, has to keep in mind. So with this, and I don't see any other questions from the audience. I would like, on behalf of AIT, I would like to thanks to all the speakers. Thanks to Dr. Liviu, Vedrasco, Thanks to Dr. Chatnarin, Metheekul, Dr. Thanawat, Tiensin, Dr. Sutayut from the World Bank for their participation and for their time. And also thanks for Dr. Jonathan Shaw to joining our sessions. And thanks to the audience that you spend time with us. And we hope that this webinar session, the first webinar session, giving you some knowledge and something very useful and meaningful for you to share with your friends and your colleagues and your organization in future. So with this, I would like to close this webinar sessions. Thank you very much again and see you in the future.